everyone, my name is Christine and I'm a nurse. Today I want to talk to you about a type of lung cancer called lung adenocarcinoma. I know the word cancer can feel overwhelming, but my goal is to help you understand what this disease is and how science is working to improve treatment and outcomes. Lung adenocarcinoma is the most common type of lung cancer, making up about 40 to 50% of all lung cancer cases. What surprises many people is that it does not only affect smokers. Many patients diagnosed with this cancer have never smoked at all. This cancer begins in the tiny air sacs of the lungs called alveoli. These cells normally help oxygen move into your bloodstream. In a healthy lung, cells grow and divide in an organized way. But when DNA inside the cell becomes damaged, the cell begins growing uncontrollably. Think of it like a photocopier that gets stuck. Instead of making one copy and stopping, it keeps printing over and over again. In the body, that constant copying creates a mass of abnormal cells, which can form a tumor and interfere with normal lung function. Lung adenocarcinoma is often driven by specific genetic mutations such as EGFR, KRAS, and ALK. These mutations act like a stuck gas pedal, constantly signaling the cancer cell to grow. The good news is the doctors can test for these mutations and use targeted therapies designed to block those signals. Risk factors include smoking, secondhand smoke, air pollution, and exposure to radon gas. However, because many people diagnosed with lung adenocarcinoma have never smoked, researchers continue to study environmental and genetic causes. Lung adenocarcinoma can also spread, which is called metastasis. Cancer cells can travel from the lungs to the other parts of the body, such as the brain, bones, or liver. When cancer spreads, it becomes more difficult to treat. This is why early detection is so important. Treatment depends on how advanced the cancer is. It may include surgery, chemotherapy, radiation therapy, targeted therapy, or immunotherapy. Targeted drugs, especially those designed for EGFR mutations, have significantly improved for survival for many patients. Recent clinical research has led to major breakthroughs in treatment. For example, a large clinical trial called the FLORA study looked at a targeted drug called osimertinib in patients with EGFR mutated lung adenocarcinoma. The study found that patients taking osimertinib lived significantly longer and had better disease control compared to older treatments. This is a strong example of how personalized medicine is improving outcomes. One major gap still exists in early screening. Current lung cancer screening guidelines focus mostly on heavy smokers. Because many patients with lung adenocarcinoma are non-smokers, their cancer is often detected later. When it has already spread, researchers are now working on better screening tools, including blood-based tests and genetic markers. If there's one thing I want you to remember, it is this. Lung adenocarcinoma is serious, but research and treatment are advancing quickly. With better screening, personalized therapies, and continued awareness, outcomes can continue to improve. Thank you for listening.